We'll be telling you about the rise in flu rates, but what about respiratory syncytial virus, or RSV? Our Sierra Shipley joins us live to talk about the numbers Texas is seeing. But first, Sierra, is RSV like the flu?
Good morning, Andrea. RSV is a respiratory infection, easily mistaken for the flu or common cold, and anyone can get it, but it's really children under the age of 2 that need to watch out. Now, according to the Texas Health and Human Services, RSV can cause bronchiolitis or pneumonia, and in more severe cases can result in respiratory failure. The symptoms are a cough that is worsening over time, usually rapid breathing or difficulty breathing, and a bluish color of the lips or fingernails. Now, most children hospitalized for RSV are under the age of 6 months, and children that age and people over 65 are more at risk.
Some parents are very afraid of RSV, but I really try to reassure parents this is not something to be scared of. We can support the child if they are having increased respiratory symptoms.
Just like any virus, the only thing you can do is let it take its course and treat it like you would a common cold. Now, in the past month, Texas Health and Human Services have reported a spike in RSV with the cold weather. That is something common for this time of year. And one of the biggest spikes this year was around the end of November. They track the virus weekly, and updated reports are on their website, dshs.texas.gov. Now, of course, there are plenty of ways to prevent RSV. Andrea, I'll let you give some ways that people can combat that.
All right, thank you, Sierra. Well, of course, the biggest thing to remember, always make sure your kids are washing their hands. And there is also a drug to prevent severe RSV illness in certain infants and children who are at high risk, but there is no vaccine. RSV is spread when someone coughs or sneezes in the air, and then those particles come in contact with someone else. You can also keep the areas around your home clean by wiping the most touched areas of the home with disinfectant wipes. Also, limit time in child care centers, according to the Texas Department of State Health Services.